Every injection is risks, and we will find the ways how to punish you. We are thinking how to protect the patient rights. If will be some problems, nobody will help you.
What are your biggest red flags?
Sometimes patients choosing the cheapest. Oh, you want? You need? Oh, let's go. Nobody is asking about the health history. Yes, we know about American Botox parties. Yes, I can tell 100% it's very dangerous.
Hi there, this is Marcus, and welcome back to our CARELIKA Beauty Talks, where we talk about the industry of cosmetology and how to take good care of your skin and your body. And today, our guest is Rafael Ciekurs, who is a medical law and emergency medical specialist. And today we're going to talk about medicine. And this show is for general information only. For personal advice, please see a doctor or a lawyer in your own country. Rafael, thank you for coming. Please tell us all about the work that you do and about your experience.
Yes, thank you for invitation. Yes, in every day I work in the emergency medicine. It's my basic life, and also I practice in university, registered in university in social science faculty in a group of law. And there we have a smaller group which are working with the medicine law questions about how we can provide safety medicine treatments for the patients, how we can think about the patient rights, and that it's this all questions with talking about data regulations, agreements from the patients that they agree for the treatments that we provide the qualified and safety treatments for our patients, and it's also responsibility for the practitioners. And we are thinking how to protect the patient rights when they are getting these medical treatments.
Mm-hmm. And today we're gonna talk more about beauty industry and all those therapies and procedures that you can do at a beauty salon, or maybe the specialist comes to your house and do all the work. But what is the biggest difference between just cosmetologist who does the procedures, masks, and like a certified doctor?
If we are looking on the on the beauty all area, then we can tell that it's quite big problems because we sometimes patients is choosing the cheapest treatment price, and they don't know, or they don't check which specialist is working with their skin. It's very high risk of that no qualified treatments get. When we are taking the cheapest treatment, we can damage our skin or face. And after then, when we want to go and ask the responsibility from the specialist, we saw that he is not the doctors, or maybe he don't know also qualified like cosmetologist or beauty specialist. Then he's have no responsibility about that his works. And also from the government side, we can't stop his job or take law responsibility from there. So the first one, when we are choosing the specialist, you very well tell that we have to understood what kind of treatment we want to make. It's the simply massage, some plastic masks, or that way skin cleaning treatments and so on. Yeah, we can choose the beauty specialist, but also remember that all beauty specialists is registered like in register who can provide medicine treatments. It's in each country is the register where you can check. You have to check like the state government rules, and where you check the name and surname and what kind of his qualified is.
So it's better before the appointment you have to
Always.
do the research.
Yes, little bit research. But if you are going to the hospital type or clinic type and you are taking the care from the doctor, we have to remember the doctor has in Latvia, for example, has studied for 6 years, and also after then he has practiced and resident in dermatovenerology, and then he can provide also like method certification he learns, and he can provide some injections, the fillers, the botuline. And I always remind for all specialists, also specialists who is not qualified, you can't provide these treatments if you don't have the given certificate in this method. So also for the patients, they have to check if this doctor has method certification, for example, in botulinum therapy, and he can provide this treatment. Usually, of course, how our patients do, they want the cheapest. Yes, they go to the home where is around it's not very sterile rooms, where is not very high quality standards. Yes, and they get the treatment more and more cheaper, but it's not safer. It's, I can tell 100% it's very dangerous. And remember our face skin, if some damage on your skin, yes, everybody will see. So I think that some few euros cheaper treatments, it will be more and more expensive in the future to correct the damage.
That's also like the thing that I heard, this term like medical traveling, which is like you go to some clinic in Turkey and do like some medical treatment there, like make teeth or like hair transplant or face procedures, and you come back and you see that it was not a good procedure. So what's your comment on this new thing that people go to some other countries and they choose this cheap treatment?
Yes, of course. If we are looking at right now in medical tourism, it's very, very, very popular right now in the world. And if we are checking that they are going to the Turkey, for example, they always have a lot of paper signs, the patient agreements for the treatments, where is written down all the risks, and you have to read this one. I suggest for persons, for the people who decide to make some teeth or going to take some operations, ask the clinic, send the regulations before that I'm here, before I take the decision that yes, I will go and get these procedures, treatments, to read and understand about the risks, what kind of risks is there. But I can tell you that some guarantees they give. And if there's about my what I know, of course, a lot of people can go and make repairing these damages. But remember that Turkey is no European Union, and it's very hard to, if some problems, then we, from the law side, it's very hard to get some back and like go and talk with that clinic specialists and find the best way how to help the patients to get money back what they paid. Yes, of course, if we are choosing in a European Union, it's easier because in European Union we have all regulations for those same global data protection regula. If some data go outside, we can't ask to protect my rights. And in of course in European Union more we are like protected. For example, we have read some lot of stories that you can sometimes you watch your head before the manipulation for the transplantation of hairs, and they have making the photos. It's okay because for the medical documentation the photos is needed. Yes, but after 1 year you see that this clinic is making from these video photos the reclam. Yes, reclam posters, and hey, see before and after. I didn't give my advert for this advert.
So how do you protect then your data? So it should be like a contract or something, or if that happens, and how you can like skip this problem?
Right now, I'm very happy about that. That company CARELIKA also thinking about the safety, patient safety, and also cosmetology treatment safety. And right now we are preparing new thing, and this is a client medical card. Which you are filling before the treatments every time, writing down the patient data, writing down the anamnesis of illness of the patients, allergies, some contraindications of some treatments from botulinum, for example, fillers, and these ones. We are right now like putting all together, and after a few times we will start offer the cosmetology specialists this paper notebook what we can fill, and it will be also very safety for the patients, and also it will be the dialogue between the specialist and between the cosmetology specialist. And also the one of the most important thing in this document will be about the data protections that specialist is telling about these data, about the global data protection regulations, which is how I told before already in European Union, and it will be responsibility for the specialist that he knows, he has introduced, and he signed, and the specialist signed that these data is keeping only like medical record. Because in beauty it's not just beauty and some fashion things, it's very important, and this is very strictly we have to keep all data together, because it's my data, it's my photos, there is my illnesses, and if I don't agree that everybody other person need to know, that nobody has rights to tell about that. Yes, and this global regulation, data protection is very important. And when we signed from both sides, it's like we have make deal that my data is safety.
So if you go back to the beauty specialists and the places where you can do all the procedures and things for your face, what are your biggest red flags about those places or the specialists that people should sort of pay attention to?
If we are talking about the red flags, of course, if it's the price, it will be impossible cheap price, because we will always remember that a good cosmetology, high quality cosmetology, it won't be cheap. Yes, because they're preparing blah blah blah, some certifications, regulations. Of course, home. Yes, if you are going to the patient's home, where is put table in kitchen, Yes, meanwhile is mask on your face and the practitioner making the soup. Yes. Meanwhile, of course, also the same red flags. Yes. Also the no labels on injectors, or it's no sterols. You come inside and there's some syringe already is opened. They don't open in your when you are see and in your side of the desks. Yeah, nobody is asking about the health history. Oh, you want, you need, oh, let's go. About pregnancies didn't asking about some before treatments. Yes, and this is all risks about what we have to remember. And we if we are taking this kind of treatments, then it's your responsibility that you know that if will be some problems, nobody will help you. Nobody. We have to check. It's also, it's not only about the damages on face. It's already very high risks of infections. C hepatitis, yes, HIV possibilities, yes, because there, if they are you are making some injections and the syringe is not opened in your
Your
tables,
presence, yeah.
table side, yes, it's very high risks.
You have also worked, and you're still working in emergency medical. What are your experience in that, and what kind of problems have you seen the most?
Most important is, of course, allergies. The allergies is a very high risks in these treatments. And if you during the treatments start feel bad, yes, you stop dizzy or pains, or you immediately need to tell your treatment provider, tell that stop. I have some heartbeats very faster, or I can't breathe normally like before that. Yes, I start sweating. Yes, the first one you ask the practitioner to take off, to stop the this allergical treatment, the procedure to take off everything, wash with clean water, and of course you have to ask the certified qualified help, and it will be of course emergency 113 in Latvia, 911 in abroad, of course. Yes, and tell that it's allergical reactions. Of course, providing maybe some in cosmetology rooms and clinics. They have these first aid treatment possibilities. Yes, some epinephrine gives, their blood checking. They know how to take the blood pressure checks and understood how to provide them the help in allergical situations. But we know that also we have prepared some lectures for our cosmetologists, and we in the CARELIKA also have online lectures how to help the patients if starting the allergical reactions during the treatment. And it's very important that the treatment specialist is learning and teaching all the time himself, and he can provide more high quality and safety treatments for his patient.
What about maybe some other problems that could happen during those procedures? Not just allergic reactions, but maybe some other things.
The allergic will be the most, but
Or maybe you've seen some other reactions in your experience.
yeah, of course.
Like people fainted or...
Yes, of course, some heart attacks can be, yes, during the massage, yes. It's not very lot of unsafe treatments, yes. Usually some body treatments, maybe I have one case when there was like vacuum massage for patients, but the treatment specialists make quite so big pains, and patient was in so big stress. He was thinking that it's normal, situations, so a lot of pains. He started being with very high blood pressure, like it's very pain, and he had a heart attack.
Oh, wow.
And after that, he started get chest pains. Yes, and also the special treatment specialist didn't talk about the risks. Of course, he didn't check the cardiovascular risks or is allowed this patient. So I think that so high and so very big treatment for the patients. It's not risks to get bad for the patients. Yes, and that can be possibilities. But usually these heart attacks can be more and more in body treatments. In face treatments, not so often. In face treatments, we are talking, yes, more and more about the allergical things.
So, if we talk about the products and all those creams, and they have so many ingredients, how to check like if they are really right for your skin and they have all those laws and regulations from the region or from European Union or Americas or whatever they are.
If we are talking about our European practice and experience, yes, of course we have a European Union regulations, some rules, yes, all creams or face treatment things, some boosters, don't know what's there's some makeups, yes, they also all have providing by regulations, certifications. There you have to keep bring the all these materials to the laboratories. They are recheck, yes, and of course it's very important, yes, to that if we are taking the using the products what provided in European Union, we know that these products is certified, tested, and agree from the European Union side that it's safety and you can use them. If we are talking about other countries, how you know the England was, England, United Kingdom was the European Union part, but some few years ago they left from the European Union. So, but they have their own regulations, and of course, every countries have some regulations how they are checking. Of course, the government also want to provide for their citizens quality, safety, and of course the regulations is. But very detailed and from about all each country I can't tell. I know about European Union because we are study about the European Union regulations, and we are teaching for the students about European Union regulations, and yes.
So basically, it's like you should trust the product. You don't need to like do specific research on products, or that's like in the perfect world.
Yeah, but it's very, you can't like check each
Yeah.
bottle what they are taking and putting on your face. When we are choosing like the same, when we are checking which specialist will work with my body, we are like we check his qualified, yes, what kind of qualifications he has. We are checking also with which cosmetic he works, yes, and of course this we have to check, but of course we never know what they put you. You like lay down on the positions, yes, and this I have been in experience cases that for example these cheap practitioners, yes, they put the expensive these bottles on the bedside, and but really inside of these boxes is not the same product. It can be cheap, not qualified, yes, and we are not preparing the high quality service for the patients and the clients. And very important that, yes, that if we are paying and we are choosing the certificate clinic or certificate room where we get the service, yes, that it's more safer for you own. And also remember that what I want to remind for the treatment providers, that we also data issues checking, and if they're written down that after the bottle opened or the cream opened, it's 6 months data issues, that we always write with marker on the bottle, the cream, the date when we opened, and this we can checking, oh, that the issue is end, and we take off the product. And also when there comes some checkers, like checking you can see that I opened this one. When we are work with persons, we and providing them medical some things, it's very big responsibility, and the responsibility from both sides, from the client side, that it's my responsibility if I didn't check who will work with my body, and also the responsibility from the treatment specialists, how I provide my service, safety, high quality, all those things check. Yes, it's very important. And I want to ask for the specialists, don't make these mistakes. Yes, if of course medicine law is like growing up, and we will find the ways how to punish you, work like it's written down in the papers to provide very high quality and safety treatments for the patients.
What about the rules of injection procedures? Like, because probably there are some different rules for injections in Europe and UK and even America.
Yes, and we know about your American Botox parties. Yes, when some cosmetology
With
come
champagne.
with champagne, and their cosmetology comes with
Because
the
that's so
table.
much cheaper.
Yeah, but it's fun, of course.
Fun.
Every injection is risks. Infection risks. It's some possibility risks, other possibility risks. So when we are taking these treatments, we always have to think about 2 steps next, about the infections, about who providing, if some damages is possible, that I will can ask some responsibility from the provider. Did I write it down, some documents, agreements, and what they tell me, what I will can ask after then is some problems, how to get some corrections or the same money back. And that's why every country has their own rules. But usually in botulinum therapy, filler therapy, injections, it's method certification. And in the European Union, mostly it works with that doctors. So 6 years, for example, in Latvia, 6 years study like doctors, and after then residency of dermatology and specialist.
So if you do injections, then only do that with a specialist that is almost a doctor.
Yeah, it's my suggestion. It will be more better for you.
Maybe now let's do a quick answers. I have some questions. There's so much information out there, but maybe we can just clear the air with some of the myths and information. So, can pregnant women get a Botox injections?
I tell no, but these questions you have to ask about the treatment provider. And when you are pregnant, please choose only the doctors. Yes, but I tell no.
So, how many study hours are needed for laser hair removal?
Yes, in each country it's other. Of course, it's like a plus method for the already treatment providers. Usually in Latvia it can be 30, 40 hours. Of course, because who sells this laser technology, they also provide the education, and each company have their own rules how they are preparing the persons how to work with these technologies with these apparatus and this like that one, and can be differences, yes, because each apparatus have each rules.
How can I make a complaint if something goes wrong?
Of course, in Latvian is inspection of health, where you can write the letter, introduce all information about the treatment, what was bad, what wasn't bad, and of course it's in European Union. They are like protect your patient rights, and when you are getting some medical or beauty treatments.
Okay, thank you for this. And to summarize our podcast today, maybe you can give us a short checklist for our viewers that they can take home after this podcast. What do they need to know, and like what they need to keep it in their minds?
Of course, we are always practitioner license checking. Also, we are checking is the room where they are providing the medical or beauty treatments are also registered. In Latvian, we can check in health inspection of the health. There has the database. And for example, you are going to AWO 221, for example, there is beauty clinica, there's a note there. Beauty. You go in this, open the internet, go in this register and check. Oh, they are in this register. Fine, it's good. Read and keep the constant form. Yes. Also, you are always ask for the medical record card to fill, to talk about all possibilities. Yes. When you are buying in these salons or medical clinics some take home products, check that they are unopened. Yes. And if something goes wrong, make the photos, because when we are talking about the medical laws, we need some information that's providing that it was the problem that wasn't give for you high quality treatments, and each photos can help us to understood what was wrong or what was good, and what can help you in some problems. And of course, remember about the emergency number in that country you are. If some allergical things or some big pains or some seriously health problems, then you immediately need to call 113 or Latvian 112, or in other countries a lot of works 911. And then you are talking with dispatch, tell him the problem, and he will decide to send for you the ambulance team or not, or where to find the best other medical help, for example in hospitals or health centers, and that way.
Thank you for this information, and hopefully these cases are not going to be very common in your life, but thanks for watching us today. Thank you, Rafael, for joining us today and explaining all this side to beauty industry. And here again, that was CARELIKA Talks. My name is Marcus, and see you in the next episode. Thank you.